acupuncture and myofascial lines for the neck, back, and shoulders. So let's jump into some of the material here. Now, I've taken these slides, most of them at least, directly from the course. We'll go over about 10 or 15 of these tonight. In the course material, there's 61 pages of this and 8 hours of video. So there's a lot of material. I'm going to present as much as I can tonight in a very focused way. So as an introduction, we want to learn about these myofascial lines and why it's important for acupuncturists to understand this. And this is something I reflect on a lot, because if you just look at this quickly and associate it with the meridians, you can miss a lot of things. And in our training as acupuncturists, we spend so much time learning point locations and needle techniques and these things. But as I've looked at several programs and have known a lot of acupuncturists and worked with a lot of acupuncturists and taught a lot of acupuncturists, many of us are much less knowledgeable about anatomy. And once you start to understand the anatomy of these myofascial lines, then it's really going to help you to understand a lot of different things, such as needle depth, needle angles, insertions, and just the anatomy itself, as well as how this relates to structure and function. Okay, so anatomy is the structure of the body, and then the physiology and the function. So in any system, we need to consider how structure and function are interrelated. And the better understanding you have of the anatomy, then the better results you're going to get and the better functionality you'll achieve in your acupuncture treatments. Okay, so I always like to go back to the basics too, and like I'll contemplate just those two concepts of structure and function for, long periods of time. I'll just contemplate the way that they're interrelated and the way that relates to point functions and energetics and things. Okay, so we're going to cover some of that. Now, this also relates to alignment and posture as well. And like I just commented on in regards to anatomy, a lot of us acupuncturists haven't received a lot of training in terms of how to structurally assess people and how to work with alignment issues and postural things. And I've worked extensively with chiropractors and physical therapists, and most of my 20 years in practice, I've shared office space with chiropractors and physical therapists and osteopaths. And so I was always interested in, what they do, and we're referring clients back and forth. But for many years, I couldn't wrap my head around the structural things that were going on. So I just kind of leave it to the people that I was working with. But then as I learned these myofascial lines, it started to make a lot more sense. And it gave me a system and a method where I could integrate structural alignment disorders into Master Tung's points and into, TCM as well. So I think that's really important for us to start understanding that more. And I resisted it for a lot of years because it's a different way of thinking and the biomechanics of it and all of that. And it's something that I did resist, but the more that I've learned about it and the more I've equated it with the myofascial lines and the meridians and the point functions, the more it's helped me to get better results. Now, I also want to emphasize, though, that this isn't a class on structure and alignment where we go into a lot of detail. And I draw from Tom Meyer's book, and he just speaks about 4 basic principles. And we'll speak about that more tonight. So understanding structure and alignment, it can really be quite simple using just 3 or 4 principles and learning some quick checks. And I'll show you more in a later section. I also want to talk about how these myofascial lines, they exist on 2 different levels, basically. There's a superficial level and a deep level. Okay, so let's jump ahead and look at some of these, and some of you have probably heard this before, but let's look at the arm lines. And we see here on the left side that this image here is what's called the superficial back arm line, and it includes the trapezius and the deltoids, and then the forearm extensors. And then over here at the deeper level, we've got what looks like the small intestine meridian. And you can see that it's at a deeper level here in the back because the trapezius sits on top of these muscles. Now, this is a really important thing to consider too, because if you're doing a needle technique that's only getting to that superficial level, or if you're using points that are only working on that superficial level, then you're not going to reach those deeper level structures. So once you start selecting points and doing needle techniques that get to those deeper level structures, then you'll be able to have a better effect on those conditions of the neck that involve the deep structures like the vertebrae, or if there's degeneration that's present, or cervical herniations, or inflammation in the spine, or anything like that. You've got to get to those deeper levels. And if you're not, and if you're only doing, the points here on the hand on this line here, like so Luo Zhen and Sanjiao 3 or 22.03 and 22.06, if you're just needling those superficial levels, you're just not going to get to those deeper areas. So it's a really basic but fundamental teaching to understand how the meridians relate to these myofascial lines, and then how that relates to superficial levels and then the deep levels as well. Okay, so just that teaching there can take you a long ways and help to improve your needle technique as well. Okay, let's go back to some of this intro stuff. I just want to make sure that I cover some of this. So I won't say much about this one here. We already talked about that. Understanding these myofascial lines can also help you to better understand when you should be using contralateral needling, when you should be needling on the same side. I rarely do bilateral needling because the medical research has shown for heart conditions that it just doesn't seem to give any greater improvement than just needling on one side. I did do a bilateral needling session today though. And then the other thing that this can help us to better understand are developing treatment strategies. And there's two ways that we can think about this. We can think about it in terms of starting with distal points and then moving more proximally, which is a great strategy. If you've never heard that, if you're new to this webinar and you've never heard me speak before, or even if you're at an intermediate or even advanced level, I can't stress enough how important this is to most of the time start with the more distal needles and then move more proximally. Okay, and this is something that I came across many years ago with an osteopath that I was working with, and it's something that I use extensively because with the distal needling, like we do in the Tung style acupuncture and in the balance method, it works really fast, right? Like you've all probably had that experience now where you've stuck a few points in the hand for their neck or their back, and you get instant results, starting with those more distal points. Now, I don't put the fingers in there. The fingers are something different, and that's something I cover in the class too. We'll speak about that a little more tonight as well. So generally, you want to start with distal points and then move proximally. And you can do this in the course of a single session. So a lot of times, let's say a client has pain here in the neck. I just had one the other day, came in left side neck pain in the urinary bladder meridian, and he had x-rays and MRIs done recently, and they found that there was degeneration that was present in his cervical spine. Okay, now I still started with the superficial level because he also had the pain coming down into the trapezius and GB21 area. So I start with the like 22.03 and 22.06, and then Sanjiao 5. So Sanjiao 3, Sanjiao 5, and then Luo Zhen for the TCM people. And then you have them move their neck, and either they're going to get results or they don't. If they do get results, then you know that you've cleared that superficial level out. Okay, you've worked the trapezius. If they don't get results, and often the people that have deeper level stuff going on, like degeneration or herniations or stenosis or something like that, then they may get results because those superficial levels are still going to get affected. However, you need to make sure that you plug those deeper level points in there too. Okay. So I like to start distally and then move more proximally, but I also like to start at the superficial levels and then move to the deeper levels as well. Okay, and there's various reasons for that, but we're still just in the intro here. Okay, the last point here, it reads primary, secondary, and tertiary points. So you've probably got this, I've got this. There's like primary points that I always start with when I'm treating neck and upper back pain. And typically those are the points on the superficial back arm line here, which we're going to be speaking about. Let me just kind of jump ahead here quickly because I want to show you how I organize this. And so if we look at these hand points here, this is the superficial back arm line, okay? All of these points can be used for treating neck pain, okay? So how do you decide which ones are going to be best for your client? How do you do that? Do you use the systems approach? Do you use a TCM approach? Like what determines how you select whether to use 22.03 here and 22.06 or the finger points? These are also indicated for neck and spinal disorders, okay? So, or, 22.07 and Yao Tong Shui here, these are really good for lumbar pain. We're going to talk about that a little bit too. These are used for neck pain. These are balance method teachings from Dr. Tung, from Master Tung. But you can also use points like LI3 over here, 22.04. You can use Fan Ho Ji here. You can use 22.05 or Ling Gu as well, because it's so great for pain. And then over here, we've got small intestine 3, 22.08 and 22.09. You can use San Cha. So how do you know which ones are going to work best? Well, because they all work a little differently too. And this is part of the reason that I've color coded them. So one thing that I want to show you here is, now I love TCM and the traditional concepts and theories, and it's so poetical and beautiful. And I also like to understand what's going on from a Western medical perspective, because there's been a lot of research done now, and there's a lot of things that research can teach us about how to refine our technique. And it lends a lot of insight into the traditional methods. So I love the marriage between these two systems, and really that's the yin and the yang. And occasionally I encounter acupuncturists who are just about the traditional systems, and they don't really care too much about the Western stuff. And I think it's really important and getting increasingly important that we become knowledgeable about this, especially if we want to develop referral networks with other doctors, because we need to learn to speak that language. And if we can describe to other doctors, it can potentially refer us patients, and we can describe what's going on with the nerves and what's going on myofascially and what's going on biochemically, then we're going to earn their respect, and we can have good referral networks going with the rest of the medical community. So one thing that I want to point out here, because one thing that I found clinically, Dr. Tan taught this beautiful point combination of Ling Gu and Da Bai and Xia Bai. So it's LI3, 22.05, and then 22.07. Great point combination for lumbar pain. Really amazing, effective combination. Well, then there's this other point combination using Yao Tong Shui and 22.07 here. So great point combination for low back pain as well. So for a lot of years, like I compared and contrasted this, and I would sometimes do this 3-point combination, and then sometimes I would just do the 2 points. And I started to find that essentially they produce the same results. And I couldn't really, and I still can't even make any fine distinguishing remarks about how they work differently. Well, I can in some regard, and I discuss it in the course. But what I want to bring your attention to here is the way that this group of points here works very similar to Ling Gu, Da Bai, and Xia Bai. And I think that part of the reason of what's going on here and why it's so effective is that we're stimulating this superficial back arm line, but we're also influencing whole different nerves. So here we see the dorsal view of the hand, and then these are the cutaneous nerves. So at this level here, so like with Ling Gu and Da Bai, we're stimulating the radial nerve. And then when we do the points over here, it's affecting the ulnar nerve. So by stimulating those two different regions across these two nerves, it's going to produce a strong reaction. Now, if you compare that to like needling 22.06 and 22.07 for low back pain, okay, because that's also indicated for low back pain. That is a 2-point combination, 22.06 and 22.07. Now, if you just do those 2 points for low back pain, you're going to find that it doesn't produce as strong as a result as using Yao Tong Shui with 22.07. Okay, try that out. Go try it on 100 people over the next, few weeks or over the next year or whatever. Just, try it on your friends and family. Just needle those two, and you'll get some relief, but you're not going to get the profound results that you get if you needle Yao Tong Shui with 22.07 or Ling Gu, DBAL, and Xia Bai. Okay, so, and you can do the same with this too. If you needle like 22.03 or Li3 and then 22.05, and you don't put that third point in there, you're not going to get as strong as a result for back pain as you do when you put that third point in there. Okay, so I hope that's clear. I want to bring your attention to here as well is that if you're going to needle these blue points here, this can be a great combination for back and shoulder pain as well. But because it's on that large intestine channel, there's that yang-yin connection. So if I'm treating neck or shoulder pain, but they have frontal headaches, like I definitely want to use those because of that yang-yin connection. However, if they have like the temple headaches with the neck pain, then you're going to find that it's more effective to use 22.03 and 22.06 and then Sanjiao 5. Okay, so, but all of these points, taking this back to the myofascial lines, all of these points are on this same area. So they do work in a very similar way because they're all on the superficial back arm line. Okay, so you can get a similar result with them. And this is why they have essentially very similar indications. They're treated for use for neck pain, back pain, shoulder pain, scapular pain, spinal disorders. Now, where do some of the differences exist and why are there some differences? Well, part of the reason there's some differences is because different points are also going to work on different nerves, as I've discussed here. Now, when you come up here into the fingers, this is another thing that if you've used the system for a lot of years, you've probably found that if someone walks in with, let's say, neck pain or low back pain or shoulder pain, and you try those finger points, a lot of times you're not going to get a result. And it depends on what's going on, but generally, like I wouldn't start with those. They do have very specific uses. I like them when the nerves are involved, because think about it from a neurological perspective, okay? The fingers have, and the hands as well, they've got a lot of nerve endings, right? They're very, very sensitive. So this is part of the reason that they produce a really strong result, is because it's producing a strong neurological result. But these points in the fingers, you're not gonna get a strong myofascial response like you do with the points in the hand. Okay, and this is a really big thing to understand, because these points here in the hand, there's a lot of muscle there between those bones. Those are primary muscles that hold a lot of tension, okay? So when you do the hand points, and if we compare them to the finger points, you're gonna get a strong neurological response with the hand points. You're gonna get a strong myofascial response with the hand points as well. You're not gonna get that myofascial response with the fingers. You'll get a great neurological response. And I like to use these finger points, like, say you've treated someone and they've got a lot of muscular pain in their neck or their upper back, and you've alleviated the pain, they're feeling good, but say they've got like a little band of numbness or tension, and I like to call it like the nervy type pain, or and it may not be really severe, it could be severe, there might be a herniation going on, but they get the numbness and the tingling down their arm that's related to nerve compression at some level, okay? Then these finger points can be really well. I like to use them more towards the end of a course of treatments to put the finishing touches on it rather than in the beginning. Because if someone hobbles in and let's say they threw their back out or they threw their neck out and you do these finger points and you only do those finger points, most likely you're probably not going to get a very good result. It might decrease the pain for, you know, you might decrease the pain by 20 to 40%, but it's not going to last as long either. And this is something that they've found in the research as well. Did I put that in here? Is the medical research, they found that if you just stimulate the cutaneous receptors, so the cutaneous receptors are in the skin, okay? If you just stimulate at the skin level, it doesn't give as a long-lasting result. Now, if you've been using this system and using the finger points and you've got experience with that, you've probably found that to be the case, that generally, if you just do those and isolate them from other groups, you'll generally find that they just don't give as long-lasting results. And if it's a large area of muscular region that's affected, you're just not going to get that myofascial response like you do with these points, okay? So it's a good thing to understand, because I really struggled for a lot of years with how to use these finger points and how to get effective results with them. But once I figured out that, it got real clear, and now I use them when I need to. I want to go back to some things. I don't want to spend too much time talking about tensegrity because I've spoke about this before, but tensegrity is a word that consists of two words, tension and integrity. And it describes systems of compressed parts in a net of tension, or basically tensegrity has to do with the way that we hold tension in our bodies. And everyone holds tension differently. Some people hold it in their shoulders, some people hold it in their abdomen, some people hold it in their chest, some people hold it in their hips and pelvis. So rather than thinking in terms of chi stagnation, I find it really valuable to think about, where is this person holding tension? And how is that tension being held in a way that's systemic? You know, so how can I find the 3 points that are best going to release the tension from the whole system? And I'll use TCM and Zongfu pattern identification to help with that. And I'll use, the 6 systems, and I'll use these myofascial lines, and I'll use structural assessment. So using those things, the traditional methods like Zongfu methods, and using the 6 systems and knowing the anatomy and the muscles of the myofascial lines, and being able to do some structural assessment, when I integrate those things together, then I can find those 3 to 6 points that are going to release the tension from the whole system. Okay, and if you really understand tensegrity, then that's what you'll be able to do. You can drop your needle, your total point count down from whatever you're using now, 3 to 6 points. I like to start with 3, get them out of pain, and then put 6 or 3 more in as a bonus. And I'll do more, it depends on the client. And this is something I talk about in the course too, is that, there's some clients where I don't hesitate using 15 or 20 needles even. I've trained in China a lot, and I've seen them put 30, 40, 50, 60 needles in people, and I've done that myself. And if a condition warrants it, I'll do it, but it's typically not necessary. Very, very, very rarely will I needle and use more than 10 or 12 in a session, and often I'm just using 6. Now, one thing I discuss in the course, though, is you really need to understand your patient and their constitution and the way that they respond. If you've got a hypersensitive person that doesn't like needles, and they're skinny and they're frail, and they're anxious, and they've got like liver yang rising, and they got this type of thing, and you try to put 12 needles in them, forget it. You're going to lose them. They're not going to come back because you overstimulated them. You caused too much sympathetic stimulation that aggravated their yang. Forget about it. They're gone. You won't see them again. Okay. So for hypersensitive people, you really need to be able to use just 3 needles and get a result. Because they don't want any more, and their systems are so naturally sensitive that you can do 3 needles and take care of their top 3 health concerns. Now, at the opposite end of the spectrum, we have the non-responders, or the people that are slow to respond. These are the bigger people. These are people that are overweight, or some of them will just have big bodies, maybe that are naturally muscular. The big people tend to respond more slowly, so you need to use more needles on them as well. Okay, but I do speak about using 3 to 6 needles because it's a good way to learn about how different point groups work. So let's look at those hand points again, okay? Let's say that you have a client, they come in, they have neck pain, okay? A great point combination, typically where I start when I'm treating any type of neck pain, even if I know that they've got herniations and degeneration or stenosis or something at a deep level, typically 95% of the time where I start with treating neck pain is, there's a few different combinations, but we'll start with 22.03, Luo Zhen, and then Sanjiao 3 or 22.06, and then I throw in Sanjiao 5 as well, okay? Or Sanjiao 6, palpate, find the tension, okay? This whole thing about, a point is specifically located at this region with, 2 sun up. The textbook locations are, they're just that. You need to be palpating people and finding where they hold tension, because everyone's not holding tension precisely 2 sun above the wrist crease. So there's been a lot of research on that too. And numerous studies have shown that it's better to palpate and find where the people are holding tension. Okay, so we've got 22.03 here, 22.06 here, and then something around Sanjiao 5 or Sanjiao 6. Now, if we look at this superficial back arm line here, we can see how putting that point in here and here is going to work this line. It's going to work through the trapezius, and that can be very beneficial for alleviating pain at GB21. Typically, we needle that on the opposite side. Okay. Now, you can also needle it on the same side, and a lot of times it can even be more effective needling on the same side. So if you do that point combination on the opposite side and it doesn't work, one thing you may want to try is to do it on the same side. And that has to do with not only how people are holding tension, but it has to do with whether it's an acute condition or a chronic thing. So for acute conditions, generally speaking, it's better to needle on the opposite side if you're using system 1. Okay, for more chronic conditions, if it's a chronic pattern here at GB21, then a lot of times you'll actually get a better result by needling the same side. So imagine that. Look at a picture here, okay? This is a guy I just saw the other day. Now, I didn't put this one in the course because he just came in the other day. I was treating him for lymphoma last fall, and then he came in and I gave him herbs for that, and he's happy with the results. We got rid of some of the symptoms that he was having, and then he came back and he's seeing me for neck pain now. And what I want to point out here is, so he has the degeneration here in the cervical spine that's been confirmed with x-rays and scans. And then the other thing I want to show you here is, look how uneven his shoulders are. This shoulder is way higher. He's like falling over to this side. Okay, so if you're trained in TCM and you're treating pain here, if you're doing the balance method or Master Tung system, the pain's in primarily the urinary bladder channel, and you can think about the 6 systems and all of that. But if you're not seeing what's going on here with these uneven shoulders, then there's a big gap there. And once you start to understand just a few terms, all you have to do is learn 3 terms if you're new to this stuff. You have to learn tilt. Okay, so we call this a tilt. This is a shoulder tilt because we can see that one side's higher than the lower. And then there's shift, and there's bends, and there's rotations. You can kind of forget about bends for now. But here is a rotation as well. You can see how this foot here is rotated out slightly. And then if you look at his knee, see this kneecap isn't facing forward. This kneecap is also rotating externally to the lateral side, okay? And then if we zoom in here on his feet, you can see how the arch is collapsing, and then he's got this rotation in his foot as well. So I don't want to go too much into this. And again, this course, it's not a course that goes really in depth on structure and alignment, but what I do is I introduce it in a way that's really easy for acupuncturists to assimilate, just working with 3 or 4 basic principles, learning to recognize this type of thing, and then understanding how that fits into Master Tung's points and the meridian systems. Okay, so, if you're missing that stuff, like, learn about it. It's not that difficult. You can learn it. For instance, here's another example here. So this right here, this is happening to so many people these days. Right here, they're looking into their screens. I'm looking into one right now. I wish I could see all your shining faces and, and have that experience with you. But this world that we're living in right now, we have to sit at screens a lot. Now, I've spoke about this a bit, and let me show you this case study here. This is a woman I worked with. She was a remarkable woman because she was riding her bike. This is an actual case study in the course. She rode her bike from like Europe to Asia, and she's in her like mid-50s. And then right before Corona, she was actually going to go to America and ride clear across America on her bike. So think of someone that's on a bike, right? And they're pedaling. Often that will produce tight hip flexors, but then they're leaning forward like this, okay? And then what that does is see how her head is shifted forward. So her ear is way in front of her shoulder, okay? She shouldn't have that much of a head shift going on. So this is what's called a shift, a forward or anterior head shift, to be more technically correct, okay? So these types of things, like, you really need to start accounting for these when you're working with musculoskeletal stuff. And, if you're a traditional acupuncturist, you probably haven't got a lot of training in that. If you're a PT or a chiropractor or an osteopath, that's your specialty. And again, I've really simplified the structural stuff down in this course. It's not necessarily an emphasis, but I do give a lot of material that you'll be able to start using immediately. Now, in this case study here, this was an interesting guy. He got such great results. Like, he wants to go into business with me now and promote me. And we're thinking about what to do next when Corona, gets better and things return to normal. And he's really excited about promoting me. And he's done a lot with sports promotion and working with athletes. So he was so impressed with the results that, like, it'll be interesting to see what sort of, opportunities come out of working with him. But you can also see that there's this shoulder tilt going on here as well. With him, it looks like he's falling over to the side. His head is also tilted. And then if I don't have the lateral side picture here, but these are his legs, and then this is his pelvis. So he had this anterior tilt in his torso. And I worked that out with yoga. He was coming to my yoga classes, and I just showed him some yoga movements, and like within no time, we got him standing up straight and took care of his shoulders and stuff. So a few things there. Let's go back to, where do I want to go next? Okay, so we spoke about this superficial back arm line here. This is, one of the primary ones. We can also see how this deep back arm line is equivalent to the small intestine meridian, how it gets to these deeper muscles, how it gets to the rhomboids, how it gets to the levator scapulae, the scapularis. Lung 7 is a really interesting point, okay? I wasn't going to talk about this, but I just want to throw a little bit out there. It's considered the command point for the occiput in the back of the neck. Okay, if you've been doing Master Tung style treatments, you know how powerful these points from like lung 6 to lung 7 can be for upper back pain. Like when I learned it from Dr. Tung in New York, oh, it was a nice time seeing him in New York, and I just have so many fond memories of that. But when he taught it, he would teach that there's that long urinary bladder connection, and you can use those points, what are they, 33.13, 33.14, 33.15 for upper back pain between the scapula and the spine because of the system 2 connection with the urinary bladder and lungs. But I asked myself, once I learned about these myofascial lines, like, is it treating the trapezius or is it treating the rhomboids? Yeah, that's a big question. And he also taught that you can use like UB57 down towards the Achilles tendon. You can use those points for pain up there too, between the rhomboids or between the scapula and the spine. Great points to use, you know, and I was doing that for many, 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 many years, right? I would needle the lung points, I would needle the urinary bladder points. Sometimes it worked, sometimes it didn't. I would isolate point groups. So sometimes I would only use the lung points, sometimes I would only use the bladder points. And I asked myself, well, why does the bladder points work on this person but not this person? Well, when you understand the anatomy of the myofascial lines and how the erector spinae here, the paraspinals, how they're connected to that superficial back line, then when the problem is there in the erector spinae, you're going to get a better result by using these points, okay? But when you use the lung points, you're affecting different channels, you're affecting different lines. Okay. Now, I'm not going to give you the answer. I want you to either contemplate that yourself or get the course where I go into detail about why these points from lung 6 and 33.13, 33.14 are key points for treating pain in this area, and you know, when you should use them. There's some really interesting things going on there anatomically with that. So, and it can all be understood through the anatomy. Once you start digging into the anatomy of this stuff, then you're going to understand why those points work, when they'll work, when they won't work, when you should use, you know, some of the other point selections instead. Okay. So what I love about this too is, you know, like for a lot of years, I considered myself a mystic, and I still am. Like, I've meditated for a lot of years, and I've done a lot of mystical things and spiritual practices and stuff like this. And I love this about Chinese medicine and yoga and meditation and this type of thing. And it's one thing that brought me to this practice. But I'm also a scientist as well. And I like to think of myself as a scientist. And the reason I bring that up, though, is that I love like that mystical side of Chinese medicine because it's so beautiful and poetical. But when you learn these myofascial lines, it grounds all of that into anatomy. And because of this relationship between structure and function, when you really understand the structure of these myofascial lines, then the functionality, the energetics of the points, it's all going to start making sense. And all of those point indications, like how many of you are using UB58? You know, if you're doing TCM, maybe you're using the 7 tigers, you know, great point combination for neck and back pain too. You know, that's something that's widely taught, right? Like the 7 tigers, they treat scapular pain. You'll use them on some clients and get a great result. You can just use those 3 and get great results up here. And then other times you use them and you don't get a result for people. Why is that? Well, when you learn about the structural assessments and you're assessing people from that perspective as well, then you're going to understand why the 7 tigers work for some people and why they don't work for other people. Okay. When you get really good at the structural stuff, you'll be able to look at it and say, oh, 7 tigers aren't going to work for this person. There was someone fairly recently, it wasn't this guy. Now, this is a guy, like, I'll probably use the 7 tigers on him at some point. Okay, because there's something going on in the feet here. See that there? Something going on in the knee. Okay, so because there's structural things, he broke his ankle as well, like many, many years ago. So because I know that, and because there's structural things that are happening here that are related to all this, then 7 tigers are going to be a good point group for him. So just some little cartoons here. You know, if someone's got this going on, we talked about this client over here. He actually had that thing going on. I mentioned that. And here we see this anterior head shift as well. So when you have little bits of information like that, and you're plugging that into the 6 systems and you're using Dong's points, you're going to know whether the points on the hands are going to work best or the points on the feet are going to work best. And then you can start a treatment by just needling 3 points and then giving them some movement. So if you're a physical therapist or you like to use movement, you should be using movement when you're treating your clients by doing the distal points and then having them move their neck. This is also going to give you an understanding of how to have them move their head and neck too. Because if someone's always like this, right, they've got this thing going on, you need to be teaching them to do extensions. You need to be strengthening these neck muscles by activating them and contracting those muscles, okay? So we need to strengthen their neck, because if they're in this position here, and, well, I look pretty silly when I lean into the screen like that. So if they're always doing that, right, then these muscles here, like the SCM, this is going to be in chronic contraction, whereas these muscles in the back are going to be in chronic strain or eccentric contraction. So that's another thing that I talk about in the course as well, is contraction and strain, concentric and eccentric contractions. And I think that there's a sort of misunderstanding that's quite common, not only amongst acupuncturists, but amongst a lot of other therapists as well, even medical doctors, and the whole trigger point theory idea and the way that trigger points work and the micro contractions there. And I was reading some research on the NIH site. I love the research articles there, where someone had studied whether people like chronic pain, I think it was chronic pain, I can't remember all the details right now, like whether people feel the pain more where the contraction's at. So in this diagram here, this lateral line on this side is in contraction, but then this lateral line on this side is in strain. And it seems to be that a lot of people seem to think that the pain is present where the contraction's at. And that's true. You can have pain, and in trigger points, there's a miniature contraction. You can do trigger point treatments, but that's just a basic level, really. But often people will have more pain where there's strain, okay, or where there's an eccentric contraction. Think about people that lift something and they injure their back, right? Or they injure their neck in some way, an acute injury. Like often that's due to it's a pulled muscle. That muscle got lengthened too much. Okay, so these are some things that I discuss in the course and things that we as acupuncturists need to start understanding, because it's really going to help you tremendously refine your techniques. Okay, and it's not something I dwell on in the course. Like I'm not trying to turn you into physical therapists or overemphasize these things, because you can always just go back to the 6 systems as well and integrate that with the anatomy and get profound results. But when you do understand some of these things, and it's going to help you, it's going to boost your client return rate too. One thing that I want to talk about just before we go much further, some of the challenges, because I want to address some of the problems that we face as acupuncturists. Okay, so some of the challenges that we have are getting effective results in a good time frame. And we often only have 2 to 4 treatments to create a strong impression and get people benefits. A lot of people don't like needles, okay? A lot of people are unsure about acupuncture if it's their first time. And if you're putting in, 12 or 15 or 20 needles and they're only getting a 20% result, and maybe they feel better, it's not lasting that long. We need to get quick results very quickly, very effectively, the best that we can, so that we can increase our patient retention. If you're seeing a lot of clients that are only coming in 1 or 2 times or 3 times and they're dropping off and you're never seeing them again, guess what? You're not getting them a good result. If you want to have high patient retention, meaning that people come back and they see you many, many times, like that guy that I showed you the picture of, I treated him for lymphoma. I gave him herbs. We treated the skin conditions and some of the symptoms. He came back because I got him results, and I got him quick and effective results. So when you can get people quick and effective results, then it's going to increase your patient retention. They're going to convert to long-term care, and they're going to be lifelong clients. Okay, so one of the challenges then is getting fast results. So the more you understand this, the better you are getting better results all the way around. Another challenge that we face are choosing the best points to get the desired results. So for any given condition, there are often over a dozen points to choose from. How do you decide which ones will work? Okay, so we looked at those finger points, right? Like all these points can be used for neck, back, and spinal conditions. How do you know which ones work best? You know, I've already discussed about how the Ling Gu, DBAL, Xia Bai point combination is a great point combination. We're stimulating different nerves by needling across the hand there. You get a similar result with those, okay? So understanding these things, then it's gonna help you to get a better result straight away. I haven't even spoke about Sancha. You know, when do I use Sancha? I don't use those very often, but there are some clients that I'll use them straight away on. Those will be my first point selections. It's probably only like maybe 5% of the neck, back, and spinal people that I'll start with those. I'll typically save those for later in the treatment, or I'll use those on non-responders. So big people who don't respond or aren't sensitive, you know. If you can put like a 28 gauge needle in a guy and he doesn't feel it, and you're treating them for neck, back, and shoulder conditions, you need to be needling these points for those types of patients, okay, rather than these. So those are all things that I talk about in the course too, like how to assess your patient's constitution and their level of reactivity and how that relates to point groups. And there's other things too. That's just one of the factors. Let's go back to some of these challenges. So choosing the best points to get the desired results. The more that you understand the anatomy of how points work on the myofascial lines and how your patients respond, and the more you understand these things that I cover, then it's going to help you to choose what points will work best. Okay, another problem that we have is with pattern identification. So we've got many methods. We can use Zong Fu, 5 elements, Tung, and Master Tung systems, but they each have their own strengths and limitations, okay? If you're seeing a guy like this, right, with this big shoulder tilt going on and this going on, and you're only using the 6 systems, or, you know, if you're just doing TCM, and you know, in TCM, he's like liver fire because he's got lymphoma and a lot of these heat signs and, you know, this form of cancer. And he definitely has that. It's a Zong Fu pattern. But if you're trying to treat his neck pain and the degeneration by just doing Zong Fu or 5 elements, you're going to miss these tilts. You're going to miss this rotation in the knee. You're not going to understand how this knee rotation connects to what's going on here in the shoulders. And it's really not that hard to understand. Just start learning about it in whichever way you can, because it's going to make all the world of difference. Okay, let's go back to some of the challenges. Okay, one of the final challenges here that people generally don't like needles. You know, like how many clients, they just tell you they don't like needles, right? I don't like getting needles. But so if you can use 3 needles and get someone out of pain and have them do a few movements, like, you know, that's going to create a strong impression. They're going to refer to you. They're going to come back, you know, but if you're putting 10 or 12 needles in someone and you're only getting 20 or 30% results, you're going to lose them after a treatment or 2. You know, they might give you 3 at the most, but after that, they're going to bail if you don't get them results. So those are some of the challenges. And these myofascial lines and what I teach, I've developed this to address some of the challenges that we have, because it's really frustrating when you know that you're capable of more, but you can't get those results and you're looking for those missing links. And that's what I want to share with you, is how to get the solutions. So here's some of the solutions here. The myofascial lines, they expand our perspective about how to identify patterns and choose points. Okay, I've talked about that a bit. As there are so many points to choose from, adding a myofascial method of pattern identification and diagnosis will help you to make better point selections. When you understand the anatomy, when you understand the structure, when you understand what muscle groups are being affected or what muscle is being affected, it's going to get better results. knowing the fascial lines will help you to better understand not only the anatomy of the points, but the function of the points. So think about all those point functions, right? How many functions do the points have? So many, right? When you understand the anatomy, you're going to understand the function, okay? Structure and function. You'll also learn a lot about needle angle and how to use needling technique more precisely. This is stuff that I did this for a lot of years, and I think a lot of other acupuncturists do that I've spoken to, is we learn the location, we learn the energetics, you know, and then after we memorize all that stuff, we have to think about needle angles and needle depth and when to use threading and all these types of things too. You can't memorize it all. It's impossible to memorize. Just learn the anatomy, okay? Because then you're gonna know how to get that needle angle. Some of you are probably needling points like spleen 6 and spleen 7. You can needle those for the neck conditions, and this is something I discuss in the course. And if you look at the anatomy of this deep front line, where is that at? Oh, I didn't put it on here. So the leg yin points affect the deep front line, okay? And those are gonna affect different structures in the neck. But I know some of you are needling those points or other points and you're not getting results simply because you're not getting your depth right and you're not getting your angle right. But when you understand the anatomy and you understand the muscles that are there, then you're gonna get your angles and depth right. And you're not gonna have to memorize it. It's just gonna make sense, okay? All right, so I'm actually going to put this PDF file up. I've got these beautiful illustrations here that are a part of it as well. Now this right here, I've unlabeled this. Like, you know, if you're a traditionally trained acupuncturist, you may not know what these muscles are. Well, just understanding these 3 muscles is going to help you to understand a lot about lung 7 and why it's the command point for the neck and the occiput region. And what I want to show you here, though, is that see how this tendon here is converging down here in the region of lung 7, okay? Now, lung 7 is really not a great point to needle. I don't needle it. I prefer pressure on that point. And the reason is that, you know, if you've needled it 100 times or more, you'll notice that sometimes people will respond negatively to it, and the pain will last for a while. Because if you're putting a needle in like lung 7, where this little tendon's at, there's a greater chance of damaging that tendon, and it doesn't produce the strong myofascial result like it does if you come up. So you need to be needling this area, 33.13, 33.14, coming proximal to lung 7. You're going to get a stronger myofascial result. You're not going to injure the tendon. You know, it doesn't happen that often if you need a lung 7, but you know, maybe it happens. I think the medical literature says that adverse needle reactions can happen about 2 to 5% of time. There's a lot to say about that. I'm not going to go into details, but you know, if you needle 100 people doing lung 7, between 2 to 5 of them are going to have an adverse reaction. You're going to hurt the tendon, you're going to damage it, it's going to be sore for a few days. It's not that big of a deal. But if that's the client's first time in, you know, and they're really sore right there and their neck's still sore as well, like they're not going to come back and see you. But if you understand the anatomy and you just back those points up and needle this area, you're not going to damage the tendon. You're going to get a stronger myofascial response because the tension's up here. The simple way that you can test this, on all your clients this week, I want you to palpate lung 7, especially on your neck and shoulder people. Palpate lung 7, ask them if it's tender there. No, not really, maybe a little on some of them. If you come up here and you palpate, guess what? That's where the tenderness is at. That's where the tension's at. That's tensegrity. We're understanding how tension gets held in the system. Okay, so needle up here. Now, the final thing is we've got these other 2 muscles that are coming across and, you know, coming into the radius and converging in this area as well. So that's all I'm going to say about that for now, but I go into great detail about that in the course. And the psoas here, you know, do you know when the psoas is affected? This is a major muscle when people have low back pain, and it's on the deep front line. And you know, if you needle hand points and don't get a result for low back pain, guess what? It could be this. muscle that's affected. In fact, it can be other muscles as well. It's not just that. But if you're needling points on the hand for like neck or lumbar pain and you're not getting a response, you got to think about what other points you will use if Ling Gu and DBAL and Xia Bai don't work, or if Yao Tong Shui doesn't work, right? Well, it might be this muscle, and this muscle is non-responsive to those hand points. You may get some results, like if it's at a more superficial level, but this muscle is at a deep level. So you need to use the points that work on the deep lines, okay? All right, let me just take a quick look. We're gonna finish here. I think I've talked about everything. Here's a list of points that are on the superficial back arm line, you know, that are used for neck, back, and shoulder conditions. We've already discussed that they each have distinct differences. I'm going to teach you how to use them, when you should use one group over the other. And I'm going to leave you with this. When you get really good at this stuff, you know, I remember hearing about this for many years and doubting it, and, you know, I'm thinking, is that really possible to just use that few of needles? You know, and I questioned it, and I isolated point groups, and I experimented a lot. I treated a lot of people, studied a lot. And, you know, I don't want to say that's possible for every client, but a question I want to leave you with is, what 3 points will address your client's top 3 health priorities? I'm always asking myself that. I always ask my clients, what's your top 3 health priorities? And what 3 points as a DBAL? That's a group of 3 points, or 2 or 3 points in close proximity to each other is in the Tung system. What 3 points can you use that's going to address their top 3 health concerns? And when you get really good at this stuff, you're going to be able to like achieve that level of skill with this, because it goes back to this principle of tensegrity. How are people holding tension in their system? You know, if someone comes into your office like this and they have low back pain and they have neck pain and, you know, they have like a knee thing going on, and you can do the basics of structural assessment, and you know Master Tung's points, and you know these myofascial lines, you can find 3 points where that tension is being held, and it's going to give the quick result. And I'll give you a little hint. It's probably not where you think it's at. A lot of us may think that it's, you know, the tension's here where the contraction's at, but a lot of times you actually get a better result when you needle where the strain is at. There's a lot of other things I could say about that. You know, when you should needle the same side and the opposite side, and contractions and eccentric contractions and strains. But just for simplicity, because I always like to return to the basics, and the principle of this Zen circle here is to return to the basics. You can return back to the systems, the 6 systems, you know, and Master Tung's points. Because the simplicity and the beauty of that system, when you understand it in and out, and when you've done this for a lot of years and you've isolated different point groups, and when you've assimilated the knowledge of the anatomy like this, you can really just use a minimum number of needles. And again, weigh in on each client. You know, right now, I think the average number of needles that I use, it's often I'll just use 6. System 1 is often enough, but you got to make sure that you get, you know, the right system and understand the structural stuff as well. So keep it simple too. And at some point, wherever you're at, I know when you're learning this, it can be challenging, and, you know, maybe you're struggling along in clinic in whatever way. Return to the basics, and at some point this gets really simple when you understand these muscles and you understand how they connect to it, and you understand, you know, what these muscles are and how it relates to lung 7 being the command point. When you've assimilated all this knowledge and then put it into use in clinic, it just gets like so graceful in clinic. I think that's a good word, where you can just look at someone and immediately like understand their zone fu patterns from their top 3 health concerns. You've done your structural assessments, you know your 6 systems, and you know how you can use 3 to 6 needles to address their top 3 health concerns. There's a sort of feeling of grace and ease that comes with it as well. So I guess that's all I want to say for now. Let's see here. Looks like someone may have said something. Okay, just answering a few questions. Let's see, I'm going to post these notes. I'll send out an email probably tomorrow with this recording, and then I'll also put this PDF file up. I think this PDF file's got 17 pages or something. In the 212 course, the 212 course, there's 61 pages of this material specific for the neck, upper back, and shoulders. I also talk a little bit about the hips because you need to understand the hips and some of the structural stuff there, because if you're treating the shoulders and there's hip involvement or lumbar involvement and you're not accounting for that, then you're not going to get results. And you may run through the 6 systems and you still don't get a result, you know, and it's because you're maybe missing, you know, that there's a tilt in the pelvis or something. But when you can recognize that, then, you know, you're going to be able to choose better points. So I speak a little bit about the hips and the back. And the reason I bring that up is because Eileen's asked a question, do you use electricity? Very rarely. I can't even remember the last time I've used electricity for 2 reasons. I don't need to. There are some conditions that I think it's effective for. Hip conditions, like if it's a really deep hip condition, I think it's effective for that, but I'll still start. I won't use electricity to start. I'll start distally. You know, I might do the shoulder triplets, and then I'll start to move more proximally. I have them do movement. But for those really deep, hard to treat hip conditions, you've probably found that hip conditions can be difficult to treat with distal acupuncture, and that often they'll respond better with local acupuncture. So if it's difficult to treat hip, I'll use electricity, or, but I haven't used it. The other reason I haven't used it is I've literally been a barefoot doctor for a lot of years. I've lived in Asia for 12 or 13 years now. I've lived in very rural locations where I was the only medical person around for a long ways. And I didn't have access to herbs. I didn't have access. I couldn't carry. I was traveling the world for many years out of my backpack, and I just couldn't carry a electric machine with me. So as a barefoot doctor like that, I wasn't able to do that. But I wouldn't be opposed to using it because I know it can be really effective. And that's something that helped me. This is something I discuss in my internal medicine class, but I just want to mention it here because it relates to the electricity as well. Is if you want to get really good at acupuncture, like for a lot of internal conditions or in the situation with the electricity, if you want to get really good at acupuncture, don't use electricity and these extra things in your early treatment sessions. Save those for like session 3 or session 4. Save those for a little later. Don't pull out your biggest guns right in the beginning. Sometimes electricity can aggravate people. If it's a sensitive person, right, they're really needle sensitive, don't use the electricity, right? If it's a big person, non-responder, then charge them up like the best you can. But what I wanted to say about the herbs was that, you know, if you want to get really good at acupuncture when you're treating internal conditions as well, hold off on using herbs. You know, wait until like the 2nd or the 3rd treatment, maybe even the 4th treatment. And there's some real practical value in holding off on herbs. Like sometimes I definitely go straight for the herbs, like right away. There's some conditions that you know you need the herbs straight away. The herbs work, and I won't hold back on the herbs just to, you know, just to hold back on them or have them do more acupuncture. I won't do that. But if my Zong Fu pattern diagnosis isn't really clear, or if it's a really complex internal thing, or say they've got like 5 different Zong Fu patterns going on, like that's a problem with Zong Fu pattern identification, right? Is that so many people have like 5 or 6 Zong Fu patterns going on. And this is something that acupuncture is critiqued by in the medical literature and research, is that like acupuncturists don't agree on the Zong Fu patterns, right? This is very common. So for those reasons, I like to hold off on using herbs so that I can see the client a few times and get more clear about how they're responding to the acupuncture, get more clear about the Zong Fu pattern diagnosis. And then it also gives me a chance to use the acupuncture and see how I can treat internal conditions with acupuncture alone. And that's something that really helped me tremendously get better at using acupuncture for internal conditions, was just holding off and not prescribing herbs until like the third or the fourth session, or when I felt real comfortable doing it. And, you know, I plug that into all the myofascial line stuff and internal viscera, and in the internal medicine course. You can look at the 6 systems as well from an internal medical perspective, and find that the visceral fascia and the way that the fascia surrounds the organs and then connects to external structures, there are direct anatomical connections with those systems of Dr. Tan's. There's direct anatomical connections with like the internal external relationships with the Zong Fu organs. This is something I explore in the internal medicine course as well. And when you understand that and how that relates to abdominal diagnosis and all of those things, and why I'm so excited about this and why I'm having a hard time of just like being quiet right now is because by establishing an anatomical basis for all of these traditional theories, the 6 systems and the Zong Fu stuff, by understanding this and establishing an anatomical basis in these myofascial lines and in the internal viscera, then we are establishing that ground. And it's going to help you understand the function, but it's also going to help put our profession on a higher level in terms of how we can communicate with the rest of the medical community, and in terms of insurance coverage and all of these things. So if we want to stand up as a profession and, you know, have more influence in the medical system, which I think this medical system badly needs it, and the pandemic has revealed a lot about that. It's really important for us to establish ourselves on a firm ground. And by doing that in the anatomy of these myofascial lines, and then taking it right back to the meridians and Master Tung's points and all this stuff, we're doing that. So yeah, let us continue to do the good work and get people better and get them out of pain as effectively as we can, okay? All right, so it's a late night here in Vietnam. I'm about ready to go. I got time for one more question if someone wants to put a question out. Hopefully it's not too difficult, like no really challenging case studies about neuropathy or anything like that, please. But if there's any question. All right, so I'm going to send you the link in the email. You can download this file. The courses are available on sale now, 8 hours of video. I got bundle packages and everything. If you have any questions, feel free to send me an email. I usually respond very quickly. So I look forward to discussing this, and you know, I really want to develop dialogue here as well with everyone. So I really enjoy like when you send me emails and ask questions, and you know, we can consider these things together. Okay. All right. So from Hoi An, Vietnam, I'm over and out. Good night, everyone.
Thank you, James. Have a good night.
You're welcome.